Presented by AdClinic. We are from AdClinic YouTube channel. We offer to you regarding health advices, health tips, and up-to-date health education. You watch my video and subscribe me. In this video, I'm going to tell about ectopic pregnancy. More women in the world may face this problem in pregnancy. Now you watch and share knowledge. Do you know about what is ectopic pregnancy? During most conceptions, mate's sperm reaches the female's egg, which embeds within the uterine lining. Around 1 in 50 pregnancies, eggs implants outside of the uterus, one of the fallopian tube, known as ectopic pregnancy. Now we look at causes of the ectopic pregnancy. An infection or inflammation of the fallopian tube can cause become partially or entirely blocked. Scar tissue from a previous infection. Surgical procedure on the tube may also impede the egg's movement. Previous surgery in the pelvic. Abnormal growth or a birth defect can result in an abnormality in the tube shape. See below picture. What are the risk factors of the ectopic pregnancy? Maternal age of 35 to 44 years. Previous ectopic pregnancy. Previous pelvic or abdominal surgery. Pelvic inflammatory disease. Smoking. Endometriosis. Several induced abortions. Undergoing fertility or are using fertility medications. You must know about sign and symptom of ectopic pregnancy. Short or stabbing pain that may come and go in intensity. Vaginal bleeding. Heavier or lighter than your normal periods. Gastrointestinal symptoms. Weakness, dizziness, fainting. If you have above symptoms, you must contact your doctor as soon as possible. Now we look at what kind of ectopic pregnancy test to diagnose an ectopic pregnancy. Most common tests such as first urinary pregnancy test, second ultrasound scanning test. Ectopic pregnancies are diagnosed by your physician. The measurement of HCG level is also important. An HCG level is lower than expected is one reason to suspect an ectopic pregnancy. You know treatment for ectopic pregnancy. Firstly, medications. Methotrexate is used to terminate an ectopic pregnancy, but has some side effect of methotrexate. So, before use methotrexate, must done some blood tests to terminate the effectiveness. Generally offered when there is no heart activity within the embryo, and when levels of HCG are low. Other treatment is surgery. If you have severe ectopic pregnancy, surgery is often recommended. Laparoscopy surgery is performed because a small incision is done by a surgeon. In instances, a rupture has occurred. How about your future after ectopic pregnancy? Your HCG level will need to be rechecked on a regular basis until it reaches 0. If you did not have your entire fallopian tube removed, an HCG level that remains high could indicate that the ectopic tissue was not entirely removed, which would require surgery or medical management with methotrexate. The chances of having a successful pregnancy after an ectopic pregnancy may be reduced, but this will depend on why the pregnancy was ectopic and your medical history. If the fallopian tubes have been left in place, you have approximately a 60% chance of having a successful pregnancy in the future. You must know about methotrexate. Patients who have liver or kidney disease are generally not candidates for methotrexate therapy. But other patients are not candidates. Those who breastfeeding, active lung disease, active peptic ulcer. What are the side effects of methotrexate? Possible side effect: 2 out of 100 women. Ulcer in the mouth, nausea and vomiting, diarrhea, abdominal pain. Rare side effects are pneumonia, sensitivity to sunlight, changes in the liver function, bleeding problem due to inhibition of platelet production. 1 week after methotrexate injection, you must avoid mellow foods that contain folic acid, dark green leaf vegetables, broccoli, peas, beer, whole grains, wheat germ, orange/juice, bananas, beets, grapefruit/juice. Thank you for watching this video. If you interested this channel, subscribe this channel. If you have problems and any suggestions, please comment. Thank you. Hope to meet next video.